Introduction. Opening shot. Professor standing in front of a lecture hall. Professor: good morning, ladies and gentlemen. Welcome to today's lecture on the intricate relationship between endocrinology and respiratory physiology. In this comprehensive session, we will explore the role of various hormones in modulating lung function, development, and respiratory disorders. So, without further ado, let's dive right into our first topic. Scene transition. Slides depicting the anatomy of the respiratory system, with a focus on pulmonary vasculature. Professor: pulmonary vascular remodeling refers to the structural changes that occur within the blood vessels of the lungs. Thyroid hormones, primarily triiodothyronine, T3, and thyroxine, T4, play a vital role in this process. By exerting both direct and indirect effects on endothelial cells, smooth muscle cells, and fibroblasts, these hormones influence vascular tone, angiogenesis, and extracellular matrix remodeling. Scene transition. An animated graph illustrating the hypothalamic pituitary axis and its connection to the respiratory control center. Professor: the control of breathing is a complex interplay between neural and endocrine factors. Dysfunction of the pituitary gland, which regulates the secretion of various hormones, can profoundly affect respiratory function. For example, impaired secretion of adrenocorticotropic hormone, ACTH, disrupts the balance of stress hormones, such as cortisol, leading to altered ventilatory responses and respiratory distress. Scene transition. Images showcasing the development of lung tissue during fetal and postnatal stages. Professor: growth hormone, GH, plays a crucial role in the development and maturation of various organs, including the lungs. It promotes cellular proliferation, differentiation, and lung surfactant production, all of which are essential for optimal lung function. Deficiencies in GH secretion can lead to impaired lung growth and susceptibility to respiratory diseases. Scene transition. A hospital room with a patient on a ventilator. Professor: critically ill patients often experience respiratory failure requiring mechanical ventilation. Adrenal hormones, specifically cortisol, play a vital role in maintaining adequate respiratory drive during such conditions. Imbalances in adrenal hormone levels can disrupt the signals from the brainstem, affecting respiratory rhythm generation and ventilatory response. Scene transition. An anatomical illustration of the respiratory muscles. Professor: the effects of sex hormones on respiratory muscle function have been a subject of interest. Estrogen, for example, has been associated with increased respiratory muscle strength, while testosterone may contribute to reduced diaphragmatic function. Understanding these hormonal influences can help explain gender-based differences in lung function and respiratory disorders. Scene transition. Laboratory setup with rats. Professor: leptin, a hormone primarily secreted by adipose tissue, influences not only energy homeostasis but also respiratory control. By acting on the hypothalamus and brainstem respiratory centers, leptin regulates ventilation, particularly in conditions such as obesity hypoventilation syndrome. Its role extends beyond metabolic regulations, providing fascinating insights into the link between adipose tissue and lung function. Scene transition. Microscopic images of lung epithelial cells. Professor: parathyroid hormone, PTH, primarily known for its role in calcium homeostasis, also affects lung electrolyte transport. It regulates ion channels and transporters in lung epithelial cells, influencing the balance of sodium, potassium, and chloride ions. Disturbances in PTH levels can disrupt lung fluid balance, thereby impacting respiratory function and susceptibility to respiratory infections. Scene transition. Animated representation of lung tissue regeneration. Professor: insulin-like growth factors, IGFs, play a critical role in tissue repair and regeneration, including lung tissue. They stimulate cell proliferation, collagen synthesis, and angiogenesis. Dysregulation of IGF signaling pathways can impair lung tissue regeneration, thereby contributing to the development of chronic respiratory diseases, such as chronic obstructive pulmonary disease, COPD, and idiopathic pulmonary fibrosis, IPF. Scene transition. Sleep laboratory with polysomnography setup. Professor: sleep apnea is a common respiratory disorder characterized by repetitive cessation of breathing during sleep. Neuroendocrine factors, such as changes in the activity of neurotransmitters and hormones, can influence the function of pharyngeal muscles involved in upper airway patency. Understanding the intricate relationship between the nervous and endocrine systems provides a deeper understanding of this prevalent sleep disorder. Scene transition. Images of human circadian rhythm regulation. Professor: melatonin, commonly known as the sleep hormone, not only promotes sleep but also influences respiratory physiology. Disruptions in the circadian rhythm, regulated by melatonin, have been associated with respiratory disorders, such as asthma and chronic bronchitis. Studying the interplay between melatonin and the respiratory system reveals potential therapeutic targets for these conditions. Scene transition. Laboratory experiment showing cortisol measurement. Professor, cortisol, the primary glucocorticoid hormone secreted by the adrenal glands, has widespread effects on the body, including the respiratory system. Imbalances in cortisol levels, such as those observed in Cushing's syndrome or adrenal insufficiency, can lead to various respiratory disorders, including increased susceptibility to infections, reduced lung function, and impaired ventilatory responses. Scene transition. Doctor's office with a discussion between the professor and a patient. Professor, hormonal contraceptives, such as oral contraceptives and hormonal intrauterine devices, are widely used by women for preventing unintended pregnancies. However, these contraceptives can have varying effects on respiratory symptoms and lung function. Understanding these effects is crucial for providing comprehensive health care to women, considering the prevalence of respiratory disorders in this population. Scene transition. Professor summarizing key points on a whiteboard. Professor, today, we explored the intricate relationship between endocrinology and respiratory physiology. We discussed the roles of thyroid hormones, pituitary hormones, growth hormone, adrenal hormones, sex hormones, leptin, parathyroid hormone, insulin-like growth factors, neuroendocrine factors, melatonin, cortisol, and hormonal contraceptives in modulating various aspects of respiratory function, development, and disorders. By delving into these complexities, we enhance our understanding of the multidimensional nature of respiratory physiology. Closing shot. Professor bidding farewell to the students. Professor, thank you for joining me today. I hope this comprehensive lecture has provided you with valuable insights into the fascinating world of endocrinology and the respiratory system. Remember, these interconnections go beyond what we covered today. Keep exploring, questioning, and pushing the boundaries of knowledge. Until next time, take care, and stay curious.